you struggle with back pain? If so, you're not alone. 1 in 6 people in England are back pain sufferers. Now, this obviously means this is a huge issue, and throwing painkillers at the problem can only do so much. Over recent years, many of our WhatSpa readers have told us that using a hot tub can be really beneficial in treating these symptoms, including, in fact, our expert for this video, Andrew Doody. Andrew is an osteopath, and in this video, I ask him whether hot tubs really are the best way to treat back pain. Thank you so much for joining me today. How are you doing?
I'm doing well, thank you. How are you?
Good, thanks. So I thought I'd better start with a bit of an overview. So obviously the focus of this video is back pain, and this is part of our Meet the Expert series. So what we're trying to do with that is talk to different experts about different illnesses, ailments, and social problems that people face, and how potentially people can use hot tubs, hot water, and hydrotherapy to kind of treat these
Sure.
things. So we know that there's some medical evidence to suggest that hot tubs can be useful, but we want to speak to experts and dig a little bit deeper. So enough about me and what we're doing. Can I just get you to give us a bit of an introduction into yourself and your job?
Sure. Well, my name's Andrew Doody. I'm an osteopath. I work at the Fleet Street Clinic in London, so I've been here 22 years now. I got a degree from British College of Osteopathic Medicine, an honours degree there, and the University of Westminster. So yeah, that's me.
That's great. And what's your kind of background in terms of experience with working with patients with back pain? What's your kind of experience there?
Well, being an osteopath, predominantly most of my patients are back pain. So out of everybody I see, probably 80–90% are coming with some sort of back or neck pain. Various sort of causes, whether it's acute sort of injuries or whether it's long-term sort of more chronic problems. But the bread and butter of what I would be doing would be back pain patients, yeah.
Yeah, and are there sort of main types and causes of back pain that you generally see in your practice?
Yeah, there are. There's lots of different causes, and some of them are acute, so people that have injured themselves or done something. The sort of groups that I see a lot of patients are far more for people that have some sort of arthritic changes maybe, or for people that have postural issues or work-related issues. So if they're working at an office, at a desk and sort of things, they can develop problems. So that counts for a lot of the people that I see on a day-to-day basis. Where I'm based in the city as well. So because of that, I do see a lot of those type of people.
Yeah, of course. And it is obviously such a prevalent issue. I read a statistic that said that 1 in 6 people in England suffers from back pain. Have you seen that it's been on the rise over the years, or and if so, why do you think that might be?
Yeah, it has, and I think that 1 in 6 is probably 1 in 6 at any given time, because I think over a lifetime you're going to be very lucky to get away without having back pain at some point. It does seem to have been on the rise. I mean, lockdown has been a specific time as well, because a lot of people have been working from home, and that changes a lot of things as well. So their exercise habits have changed, their workstations have changed. But even lockdown aside, back pain did seem to be becoming more prevalent, and I wonder if we are becoming more of a sedentary sort of society. People are using computers all the time now, so even people that aren't working with computers are still spending a certain amount of time. Mobile phones is something that you only have to commute on the train. Everybody's looking at a mobile phone that causes sort of back and neck issues as well. So it is something that really has come to the fore and built up a lot over the last few years.
Yeah, absolutely. And what do you generally do with your patients that struggle with this chronic back pain? What's your usual kind of go-to treatment?
Well, the first most important thing to do is get a good diagnosis to know what's going on. So assuming that there's nothing weird and wonderful or nothing dangerous going on, and it is more sort of run-of-the-mill arthritic changes or postural issues or something along those lines, we'll certainly treat the patient. So we will be we do some physical hands-on treatment. We might use exercises. We might use advice and things as well. And one of those advices is what we were talking about before. So hydrotherapy from a point of view of hot and cold, and heat onto the back for those sort of things as well. So there's lots of different techniques that we would use for these kind of more long-term chronic conditions.
Yeah, Anecdotally, I've kind of heard that when people tend to go to doctors to talk about their chronic back pain and pain issues, a lot of them are being sent away with very strong painkillers and not a lot else. Is this something that you've seen in your time in your work?
Yeah, very much so. Unfortunately, I mean, it's a problem, especially with the NHS, because doctors don't have the time for these kind of conditions or the funding for these kind of conditions. So anything more life-threatening, more serious will definitely be investigated. If something's just painful and is not causing any other issues, it tends to drop through a little bit. I mean, it's not the GP's fault by any means. You know, they're doing all they can, but it's not a solution. You know, we need to get to the cause of the problem and fix the issue rather than just covering it up with painkillers. And in some ways, painkillers can make things worse, because if you're not feeling it and you're re-aggravating it at the same time, that can certainly aggravate the problem. So it's not a good solution, and it is something that happens a lot. You know, I mean, often the best with a GP, they will maybe refer you to physio, but you may have to wait 6-8 weeks to see a physio who will then quickly assess you, give you some exercises that you probably could have got off the internet, to be quite honest. So it's one of these things that it's not satisfactory. We do need more to be looked into, really, and to more to be treated for these kind of conditions.
Yeah, and when you mentioned about hot and cold therapy, could you tell us more about how that can potentially be beneficial for those with back pain as a type of alternative treatment, potentially?
Yeah, I mean, I'd say complementary as much as alternative, really, because it is a fairly standard thing to be doing. Different things for different incidents. So if somebody's had an injury where they've fallen, banged themselves, injured themselves in that way, pulled something, strained something, cold's often a good way to go, because you can get the inflammation down, you can numb the area a little bit. So you'd be using a cold pack or a bag of frozen peas or something wrapped in a towel, 10-15 minutes on, just to get the inflammation down. If it's a more chronic problem and we're dealing with more muscle spasms, so very often the muscles respond by tightening up to try and hold your posture and support it, and they tire quickly, they build up lactic acid, and then heat works rather well to get those muscles going, so that it opens up the blood supply. Vascularly, you get much more blood to the area, so the lactic acid, the inflammation gets taken away. It relaxes the muscles nicely, and it does a lot of good things there as well. We're talking about the actual using a spa. The weightlessness is a big point in the spa as well, because it takes the pressure off all those joints that have been compressed together by gravity, stretches them apart, allows the muscles to relax. Some of the jets give you a good massage. So there's a lot can be done from that point of view to really relax these muscles in longer term chronic issues.
Yeah, I was just going to mention, so about, there is a lot of medical evidence to suggest that hot tubs in particular are very useful, obviously coming from WhatSpa, which this is our focus. So, yeah. Is this an experience that you've had with either your patients or personally, that hot tubs can be used because of, like you say, the jets giving the massage and the hot water and that giving that kind of buoyancy and things like that?
Yeah, very, very much so. Very much so. I mean, I have a hot tub myself. I've got a history. I've played rugby, so I've got loads of injuries and loads of problems from over the years, and I find it works fabulously with me. And I do recommend it to patients as well. So hydrotherapy, there's different types of hydrotherapy as well. We can be hot and cold, or we can be talking about people exercising in a pool, which is a slightly different thing. So from a spa point of view, we're talking about three things really. We're talking about the heat that has the effect we were just talking about. We have the buoyancy, which is a huge point as well. And even with the buoyancy, you can do exercises in a sort of a zero gravity environment. So nothing too major, but just stretching and moving, and it gets the mobility back. And also the jets do give you that sort of massage and that work into the muscles as well. And there's also very much a psychosomatic side of it as well, because anything that's relaxing, people, again, anecdotally, as you say, they always tell me that they sleep far better in an evening after they've been in their hot tub and these kind of things. So if it relaxes you, if you get that release of the muscles and everything feels a bit more, you get a better night's sleep, it's really going to make a big difference with these kind of issues as well. So lots of different ways. Yeah, I definitely recommend it.
That's great to hear that you've got one as well and that you use and you find it beneficial. So hot tubs are usually around 37 to 39 degrees. And so if someone's struggling with back pain and they've got access to a hot tub, how often would you recommend that they would use one to sort of see those benefits?
I mean, if they're having active pain and they're in a sort of an acute phase of it, then as regular as you like, so every day if necessary. If it's something that you just struggle with over a longer period, a couple of times a week, 2 or 3 times a week if you can, just to spend half an hour in there in an evening will definitely help with that. You can combine it with other things as well. I'll say some gentle sort of stretching exercises. We talked about hot and cold. The one thing we didn't mention is you can do a combination of hot and cold. So you can do warm for 3 or 4 minutes and then put a cold pack on for a minute and alternate in that sense, which is good to get the blood really pumping in and out. For something that's a bit stubborn and not really shifting, it's a good way to sort of break the cycle and get things moving. So you could always use it in that sense as well.
That's so interesting. And I know a lot of our audience are going to be really, really pleased to hear that and know that there are like some different ways they can kind of help themselves. What is there anything that sufferers should do or they should avoid if they haven't actually had that diagnosis yet, in terms of, I guess, hot water or hot tub therapy or anything like that? Or just more generally, I guess.
I mean, it's interesting you say that, because getting a diagnosis is always the first and foremost the important thing, just for safety's sake, to make sure we know what's going on, that there's nothing else we don't know about. So a good diagnosis from an osteopath, from their GP, from whoever it might be, a physio even, it's definitely worth doing. There's certain things that you would avoid. So if you know that there's cardiac issues and pregnancy, low blood pressure, there's a lot of different things that you wouldn't want to be using hot water or spa therapy for in that sense. So it's always worth just checking with your GP first if you have any underlying conditions, if you're on any medication, have any blood pressure problems, anything along those lines, that the GP is happy for you to use that, just for safety's sake. That's definitely worth doing first.
Yeah, and if someone has chronic back pain and they're, there's obviously, it can be tricky to try and get access to public hot tubs. Yeah. And we've seen obviously with the lockdowns and stuff, people are, when they've needed that extra support, they haven't been able to get it. So is it something that you would generally sort of recommend someone to invest in a hot tub if they can financially, if they're struggling with those back pain issues?
Yeah, very much so. I mean, it's not an impulsive purchase by any means, so that people need to do their homework and really know what they're looking for and what they need and what the best sort of things are for that. So do a bit of homework, a bit of research. But if you can get your hands on one, then absolutely, I would thoroughly recommend people do it. As you say, you can always try. There's not many public ones out there, but some spas do have hot tubs. Give them a go. See if you're happy with that. But having one at home, it makes a difference because people use it more. They do tend to use it often. It becomes a sort of a relaxation thing to do as well. So I would thoroughly recommend it if it's not going to break the bank too much.
That's great. And do you have any other sort of therapeutic recommendations aside from what we've already covered?
There's lots of things you can do. I say exercise is a big one. So people can do stretching exercises. They can do something like Pilates is very good because it works on stability and getting the right muscles to do the right job. What tends to happen often with these chronic back pains is that the bigger muscles, the big strong muscles that you really for lifting, carrying, running, they tend to take over to hold your posture, and they tire easily, and they're the ones that become sort of achy, that the heat sort of responds very well to. So something like Pilates gets the right muscles doing the right job. So in combination with the other things and getting treatment, if you've got a problem, it's not only a diagnosis you need, it's actually treatment to do the right things and get the right advice, and have some physical hands-on treatment is absolutely worth it.
Well, this has been so interesting and so fascinating. And I know that, a lot of our audience are going to be so pleased to hear that there are different sort of techniques they can try. And, hearing it from an expert is just so much more beneficial, I think, rather than doing your own Google research and stuff.
Any questions anyone has, we're happy to answer, of course.
And so, if people wanted to contact you or look you up, are you on any social media, or is there a website they can look into?
Yeah, well, I mean, I practice from the Fleet Street Clinic in London, so they can certainly look up on the website of the Fleet Street Clinic. I have a YouTube channel, which is Andrew Doody Osteopath, to look out for. Social media, Instagram and Facebook are under Central London Osteopath, so central_London_osteopath. But feel free, they can email me at the clinic with any questions they have. So just to andrewdoody@fleetstreetclinic.com. we will try to answer any questions you may have.
That's brilliant. Thank you so much. And I'll make sure to add all of those things in so that people can get in touch or find you on social. That's really great. So thank you so much for your time today. This has been really, really great.